we're going to do the A to P open mouth. When we do this view, we want to move the chair. You never ever want to move the patient. We're going to discuss certain things that are okay to keep in. It's an absolute must to take out patient rotation. Head tilt of the patient is actually okay to leave in because that will dictate the subluxation pattern, if you will, which we'll discuss on a later video. So when we're doing the A to P open mouth, we're going to move the chair and tilt the bucky and the tube to fit the patient. We're basically trying to get an image of the misalignment, so that way we can correlate that to the subluxation, of course. So what we're going to do first and foremost is we have to kind of tweak things as we go along. So the first thing we want to do is we're going to move the tube to get a close estimation of where we're at, and then we're going to tweak the bucky and then the tube, and we'll keep fitting it in. So the first thing we're going to do is, it's not necessary for the patient to do anything at this point. All I'm going to do is kind of grossly go through the corner of the mouth and about the atlas fossa. And that's going to just get us close to where we need to be. We're not worried about rotation yet. We're not worried about anything. Just fix the tube, the corner of the mouth, through the atlas fossa. Now notice how far off I am here. So what we're going to do is raise this up. But it's also necessary to tilt the bucky to fit the back of the patient. Some patients have an extreme amount of anterior head carriage. It's going to be necessary to tilt it more. Some patients won't have to tilt it at all. You have to fit to that patient. So the first step, what I like to do is move the head clamps down here to get them in a little bit safer position. Turn this knob and then line that up and then lock. And then most times when you have to tilt the bucky forward, it will be necessary to move the patient again a little bit closer to the bucky. Not where they're pressing against it, changing their position, but just enough where they're just touching it. Then, we already know we're pretty close, so I'm going to loosen the top, the bottom, firmly holding here. I push on this part, bringing the head clamps down to about the ear level. Tighten the bottom one and this one. So now my head clamps are locked in position. Next, what I'm going to do is turn the light back on, and we're going to see where we're at. You can see we're off just a little bit here, and we're off a little bit here. So what I'm going to do is move over just a little bit there, about like that. And sometimes you have to tweak a little bit as you lock it. Then we're going to bring the head clamps in, just like this. Again, our main thing that we're taking out is rotation and not head tilt. So then what we're going to do is you want to get in a good posture. We're going to talk about that as well. And you're going to instruct the patient to open their mouth up, just like that. And then we're going to go through the top 1/4. So almost like you got this, here's the corner of the mouth, but through the atlas fossa. So it's going to be just about like that. And then I want to step in front, make sure I have no rotation, which we're clear on that side. And that's the A to P open mouth. The next image we'll be talking about is the base posterior. So starting with the base posterior, the principles will be the same. We do not move the patient, but rather move the chair and the tube and the bucky to fit the patient. So what we'll do is you'll grab with your left hand on this side of the head clamp, counterclockwise to loosen, the top one here to loosen and bring it forward. We're going to lock here. Notice I'm still holding on. Even though it's locked, we're still going to hold on with this left hand. Then we're going to unlock the bucky tilt, press the button in. We're going to go on a 45-degree angle. In some cases we'll go on a 50-degree angle, which we'll talk about at a later date. So then, now I can actually release. Everything's locked. We're going to do this in 2 motions. We're going to slide the patient backwards while sliding the bucky downwards. So we want to use extreme caution, obviously not to go too fast and to hit the patient in the back of the head. So we're going to hold the chair. It's best if we can slide the patient straight backwards. We've already taken out all the rotation from our APOM. Unlock the patient, like this, and we're going to lock right about there. Getting that close, lock the chair. Left hand here, right hand up here, loosen, loosen, and the whole thing will swing forward and down. And then I'm going to lock and tighten, lock and tighten. So now my head clamps are in a secure position. Okay. Next, what I'm going to do is grab this string, and this string gives us the indication of 40 inches. You'll notice there's 2 knots. This is just at the end, and this one here we'll use for our distance So then I usually unlock here, turn the light on so we see where we're at. What I'm going to do is bring that tube down. We're going to go close like this. So then I know where my distance is at. If I'm down here, I'm too far. If I'm up in here, I'm too close. So I'm going to get it close through here, and then you check with the distance. So I know I need to go down a little bit. Don't worry about the tilt and all that. We're just looking for the distance at this point. Once you've established the distance, then we can get in, bending our knees, looking position. There we go. I'm going to look right underneath there. And what we want to do is we want to be halfway between the angle of the jaw and the symphysis menti, but also remaining a ½ inch in front of the external auditory meatus. So it's a pretty limited angle that we need to go through. We still want it to be somewhat centered on the buccal. So in doing so, we want to be in a good posture position. We want to come in nice and tight. I'm going to get underneath that angle just like that. Then I'm going to come around the front. I want to make sure that there's no rotation. Again, never moving the patient, only moving the chair and the tube to fit the patient. Tighten our head clamps, as so, and that is the base posterior.